Hello and welcome to Arirang TV's special coverage of the COVID-19 pandemic. I'm Min Son-hee. The briefing by the Central Disaster and Safety Countermeasure Headquarters is poised to begin soon. So today, as we did yesterday, we'll begin with that regular session before touching upon some of the key announcements, including the new number of infections and perhaps government plans regarding the social distancing initiative, which is set to end on Sunday. Now that is April 19th. There are expectations for officials to launch what is being called the daily life quarantine campaign to ensure continued containment, that is, of the COVID-19 through emphasis on personal hygiene and on efforts to refrain from activities that could raise the risk of infection. The number of confirmed cases in Korea appears to be dwindling, but health officials are urging for continued caution, pointing to concerns over cluster infections and imported cases. Later on in the program, we'll also delve into government efforts to crack down on violators of self-quarantine measures, as its proposal for electronic tagging has been quite favorably received by the public here. Also lined up in today's edition is a look at a family in South Carolina where people are reeling from the aftermath of tornadoes that ripped apart houses, downed trees and power lines, and took the lives of loved ones. We're still waiting for officials to approach the podium, and perhaps then we could turn to our Kwon-soa to talk a bit about the... Oh, I think they're on stage, they're coming to the stage right now, so we'll come back to you after this briefing.
Let us now begin our regular briefing on the coronavirus outbreak in South Korea. As of today, the total number of confirmed cases stands at 10,635. This includes 983 imported cases from overseas. A total of 7,829 have been discharged following full recovery, which account for 73.6% of the total. Yesterday, we had 22 new patients, and a total of 72 more people were discharged. And yesterday, we had one more fatality. I send my deepest condolences to those who have passed away, as well as the members of the bereaved families. Yesterday, out of the 22 cases newly confirmed yesterday, 11 of them were related to the imported cases, and 8 were reported through community transmission. And throughout the past 2 weeks, we've identified the infection routes, and 54% were related to imported cases, and a total of 9.9% were the infections related and caused by the imported cases. And we also witnessed cluster infections in nursing hospitals as well as other medical centers, and 8.8% were related to the other kinds of cluster infections. And also we are identifying 18 cases, and we are doing the epidemiological investigation for that. And we have 11 cases reported at the airport, and of them, majority of them were from the Americas, and followed by Europe, as well as other Asian countries, including Qatar. And in Gyeonggi-do province, at a medical facility in Pocheon, one hospital has been tested positive additionally, and after this person has been identified, reported for the virus, after the 11th of April, we have identified 6 more new cases, and 2 of them, 2 were the patients, as well as others were the staff members. And in Yecheon-gun County of the Gyeongsang-buk-do province, we have a total of 34 patients as of now. And as of today, we also have the number of those who have been retested for the virus. And nationwide, this accounts for 163. And compared to the total number of people who have been discharged, it's about 1.8%. And by age, we also have a different numbers of the ages, and we also have Daegu as well as Gyeongbuk, which are seeing a majority of the testing of the virus. And we, at an average, it took about 13.5 days to be retested positive for the virus. And we calculated this as well as we also have the average of the days of the retesting for the virus. And this is a result of the virus infections analysis carried out on over 170 people, and a majority of them showed minor symptoms. And for those who have been retested for the positive, we have conducted the contact tracing for about 294 people, and of them, 38 people we have completed the monitoring, and the rest of the 250 we are still conducting the monitoring. So we do not have a secondary infection as of yet. And among their family members, we have found that 13 were tested positive, and all of them were retested for the positive. And also to identify and analyze the infectious rate of the virus, we also collected their samples, and we did not see the virus being cultivated. And for the 22 other cases, we are currently doing the culture testing for the virus. And the KCDC, starting from the 14th of April, we have conducted measures to react to those who have been retested for the virus. And this has been distributed to the municipal governments. And also, according to the guidelines, these will be supplemented going forward, reflecting the analysis results. And despite the decreasing number of confirmed cases, we believe that there are still risks of high risks of cluster infections, especially for those environments that are closed doors, including the PC rooms as well as restaurants. And taking this into consideration, as we go into the weekend, we also advise the public to abide by the social distancing measures as well as a good personal hygiene. And we believe that the risk of infection lies everywhere where people come into contact. Therefore, it is very crucial to reduce the contacts with other people. And if you have any symptoms, please do not go outside, and please do refrain from going to work and get screened for the virus as soon as possible. If you have to go to an enclosed environment, please keep 2-meter distance, and please wear your face masks and wash your hands thoroughly. And as for the young people, many people are going to the enclosed environment, including the nightlife venues as well as cafes, and we refrain you from such activities. And the efforts put forth by the medical staff as well as the local governments and public, we have seen a steady decline in the number of new cases. I would like to thank you all for this. However, we believe that there have been diverse religious gatherings through the past weekend, and we also saw a lot of social outings last weekend, and we had the elections. So we believe that we are at a higher risk of infection. Therefore, we still have our eyes on the trends. Today, the Prime Minister also highlighted that we have seen a decrease in the number of cases. However, he said that there are still cases of infection where the sources of infection are not yet identified. And as mentioned earlier, we believe that the case of Yecheon-gun County, we can see that just one or two people could infect the entire family, and it can also spread through PC rooms and public saunas, as well as workplaces through direct contact and close contact with each other, and it can spread rapidly. Moreover, we can see in the cities of Daegu and Pocheon, we still see new cluster infections centering around hospitals, and there are also unidentified sources of infections that are being witnessed. So if you have close contact in enclosed environment, you are prone to the virus. And if you have any symptoms, it is very important to have the testings as soon as possible. So everything depends on the speed, and this also is very crucial in curbing the further outbreak of the virus. And regarding the general elections and the Easter holidays, we will be more alert. And together with the public and the medical staff, we ask you for your cooperation, and please report to us if you have any symptoms, and please abide by the social distancing campaign and the personal hygienes, and which are the basic rules for the infectious diseases. Thank you very much.
Right, that was the Central Disaster and Safety Countermeasure Headquarters with the latest facts and figures on COVID-19. We turn now to our Khun Soa for more on some of the key announcements from that briefing. So Soa, in light of the new infections, I see we are ending the week similar to how we started it.
Right. According to Chung Eun-kyung, director of the Korea Centers for Disease Control and Prevention, we have 22 new confirmed cases as of midnight. And throughout this whole week, we have been seeing numbers in the 20s. So let's take a closer look at the figures in detail. Now, we have a total of 10,635 cases now, and one more person died, bringing the death toll to 230. And the number of people in quarantine has dropped to 2,576, while more than 70 people have recovered in the span of 24 hours, bringing the number of fully recovered people to over 7,800. Now, out of the 22 new cases, we have 14 new imported cases, and 11 of those were detected at the airport. And KCDC Chief Chung Eun-kyung also mentioned that 163 people retested positive for the virus. And it looks like they retested positive at an average of 13.5 days. So that would be around the maximum of the incubation period that we know of. So probably that needs a little bit of more research. Now, let's see how the number of new cases here in Korea has changed over time. Now, following the exponential surge in February, with daily infections peaking at above 900 by the end of that month, in March until beginning of April, they started to linger around 100, while in recent weeks, we have seen double-digit figures with this week's numbers in the 20s.
Which is why, given that trend, we are hoping that we can go back to our normal lives before the pandemic. But social distancing measures have yet to be eased.
Right. It was a really eventful week with the parliamentary elections, and we had the early voting from Friday to Saturday, and also Easter weekend. So we know by now that the coronavirus symptoms do not really show right away. So that's why this week's social distancing measures are especially important. Now, the recent extension of enhanced social distancing measures are due until this upcoming Sunday. Authorities are said to be in deep discussions on how to ease them because there are concerns of a resurgence in new cases that could materialize in a couple of weeks. This especially after the general elections and concerns of people letting their guards down in the wake of the improving situation. And that's why the government is also carefully mulling over how to make their announcement and may opt for a phased step-by-step easing in social distancing measures instead of setting a hard deadline for their termination. So they may not call this a daily life quarantine measures as they have been predicting because, a slight difference in tone could really change how people would act to those new measures.
I see. Okay, so how are things looking overseas?
Well, a country that's really not in the stage of relaxing measures yet is Japan, where cases have surpassed 10,000 on Thursday. Prime Minister Shinzo Abe announced that a state of emergency will now be in effect for all prefectures in the country, an expansion from the earlier 7 that included Tokyo and Osaka. The measure urges people to stay home and reduce contact with others by between 70% and 80% and will be in place until May 6th. Japan reported more than 570 new cases Thursday, hitting the 10,000 mark in total just 9 days after surpassing 5,000. Meanwhile, over in the U.S., President Donald Trump unveiled new guidelines aimed at easing social distancing measures and gradually restarting the economy. Schools, restaurants, and theaters are to be opened in phases, depending on the severity of the outbreak by location. Now, let's take a look at this week's rise in cases for countries with major outbreaks. Far above others is the U.S., as we can see here, with almost 660,000 cases. COVID-19 related deaths rose to more than 32,000 there. Spain and Italy's growth patterns appear to be similar, while a fast surge seen in the UK recently, which now has surpassed 100,000 cases. And the total number of infections worldwide now stands at more than 2.1 million, with more than 145,000 deaths.
All right, Swa, thank you for the update. I'll turn to Noah Ram now. Officials, I understand, have launched a task force for COVID-19.
That's right. It's a pan-governmental working group consisting of government health officials as well as experts that will assist the development of vaccines and treatments. They will support in the development efforts, including eased regulations and funding. The group has been split into 3 subgroups dealing with treatment, the vaccine and medical equipment. They will meet every week to check on developments. The group will also draw out a roadmap for vaccine and treatment research that will detail funding, R&D investment and any regulatory reform that is required. And the formation of this working group comes following a request by the Prime Minister Chung Se-kyun earlier this week in order to speed up the pace of the development of a vaccine, which is in dire need at the moment.
Right. And Seoul's top diplomat has spoken with her female counterparts about ways to ease the COVID-19 repercussions on women across the world.
That's right. Women, especially mothers, have had a hard time, especially during the outbreak, with many mothers having to quit their jobs temporarily to look after the kids at home because the kids have also had their school suspended as well. Foreign Minister Kang Kyung-hwa held a video conference with 8 of her female counterparts to discuss gender equality and women's roles in combating the coronavirus. Kang expressed concerns over social and economic challenges facing women during the crisis due to their family responsibilities I mentioned earlier, as well as other issues. She added that South Korea is mulling over and implementing diverse support measures to ease women's childcare burden and help them keep their jobs. Kang also called for joint efforts by the international community to address challenges to which her female counterparts agreed.
I see. On the economic front, the International Monetary Fund has released some gloomy forecasts for the economy.
That's right. The numbers just don't seem to be getting any brighter from these institutions. The IMF is projecting that G20 nations will see negative growth of minus 2.8% this year due to the COVID-19 outbreak. The IMF's G20 Surveillance Notes latest projection, released on Thursday, is a 6.2 percentage point drop from its previous forecast in January. For South Korea, the IMF projected growth to contract 1.2%. That's a 3.4 percentage point drop from its previous projection. It was a much bleaker picture for advanced economies, however, such as the US, Japan and Germany, which are forecast to contract an average of 6%. Despite their grim outlook, though, richer countries, including the UK, Germany and Japan, are helping poorer nations, promising $11.7 billion in total in financial aid. Germany has also pledged funds to another emergency grant facility, boosting its capacity to $600 million. And so the IMF says 50 out of a total of 102 countries seeking aid would have received help by the end of this month. The head of the IMF also urged governments and the private sector to do all they can to help emerging markets and developing countries weather the economic and health impacts of the coronavirus pandemic. She also stressed that the speed of this aid is crucial.
All right, Aram, thank you for that. We'll see you on Monday, Swa, as well.
Thank you.
Now, COVID-19 has been disrupting social and economic activities worldwide, but for people in America's southern towns, tornadoes have further aggravated the plights of people there. In this next video, we take a glimpse of a daily life of a family currently living in South Carolina.
Hello, my name is Donggan. I'm a YouTuber. My channel name is Isa the Daddy. And we live in South Carolina in the US. We moved here 2.5 years ago. I live here with my wife and 1-year-old baby.
Hello, I'm Patricia and Isabel's sleeping.
Hey, honey.
What is that? Are you kidding me?
That's what it says.
Isabel, your sister. I don't know, brother. Congratulations. Bye.
Well, I am late, but here I am. It's a little clinic, so. Is there a baby in there?
Yeah.
Oh, good. Hey, there we go. Good deal.
So here is our downtown. Looks like empty.
Looks like this park is also closed. Oh, it's a beautiful day. When we get closer, I'll show you.
You grabbed your mask?
I do. I have my mask.
Luckily, I don't have any mask. I had before. Be safe.
Well, it's definitely less crowded than normal, so I guess that's good. Wow, it's busy, but everyone is keeping their space.
Whatever today I touch is the mom's side because when you enter the market.
Hopefully it doesn't break. But other parts, like in Rock Hill, some people lost power. And I know that there was a lot of roof damage. There was a lot of damage, a lot of houses were destroyed, cars were blown off the roads. So it was a pretty heavy storm, and especially considering this COVID-19 problem happening at the same time.
I especially want to say thank you to doctors and nurses helping patients even though they don't have any masks and equipment.
Yeah, my hope is that we can all learn something from this experience, and maybe in the future we can build a better society as a response to all this suffering.
Thank you for listening.
Bye.
Indeed, there have been some very dramatic changes in our daily lives in light of the COVID-19 pandemic. In this following clip, we take a look at the efforts aimed at ensuring safe and convenient services to patrons via the use of drive-thrus.
자가격리 중 무단 이탈과 재이탈 사례가 발생하여 관리를 강화할 필요성이 지속적으로 제기되어 왔습니다. 자가격리 지침 위반이 적발되었을 경우 즉시 고발하고 손해배상 및 구상권 청구 등 무관용 조치를 철저히 이행하도록 하겠습니다.
All overseas arrivals and those who come into contact with infected patients are required to spend 2 weeks in self-isolation. The government has also put into place penalties against people who violate this preventative measure. For more on this, I have Professor Anjun from Yonsei University. Welcome, Professor An.
Thank you.
And I have Antonjourdz, a freelance journalist from Germany. Hello Anton. I'll start with you, Professor An. I understand there are some 50,000 people in self-isolation here in Korea, and the government is keeping track of them through smartphone applications. But as we saw in the video, there have been cases of violations.
Yes. Yeah, I mean, there's, well, as you know, the new, occurrence cases like below 30, right, for last 5 days, and today is about 22. That's very, very good sign. But however, at the same time, there's increasing number of violations of the isolation rule. That's very concerning because that, it's maybe perhaps it's natural because it's a growing number of the isolation cases. So there will be more people who will violate it. That's concerning, right? So yeah, I think and the process is like we're concerned about the second phrase is like more like a community spread again, and then there's a reoccurrence. That's very problematic. So that's why we take maybe stronger measures at this time.
Right, and we are worried about cluster infections given the reality that we had our general elections earlier this week. Anton, before we touch upon the penalties for self-quarantine violations in Europe, let's start with the current lockdown in place to curb contagion. Do you see the lockdown in many parts of Europe being extended?
Well, that depends very much on the country, actually, because every country handles the problem in a little bit of a different way, I guess. Some have started the lockdown more early than other countries, and so some also released the lockdown a little bit more earlier than others. So we have seen in the last days most countries actually slowly moving towards rather opening up. But a few countries, for example, France and England, have extended the lockdown period until almost the middle of May, so almost another month to go, which is a long time for those countries. Britain in particular has started a little bit late, France has rather started a little bit early, but other countries like Austria has started to slowly move back towards a normal life, Denmark as well, and also Germany, German Chancellor Angela Merkel has just a few days ago announced measures to slowly move back to normality.
Professor An, the government here is poised to introduce electronic tagging for those who violate the self-quarantine protocol. The electronic tagging we're talking about are the so-called safety bands. Now, that's a euphemism of sorts because of the association with the ankle monitoring for sexual offenders. This decision follows a survey that showed immense support for the government's proposal. What are your thoughts on this?
Actually, I checked the two surveys, and both shows about 80%. Supporting. So a pretty high number. I mean, it's a big number. So I guess, and personally too, I mean, because first time I heard about the, safety, waistband is like, I would say maybe there's human rights violations and some problem issue, but however, the application is only limited to the violators. So if you comply with all the self-isolation rules, we will not have to wear the, the electronic, waistband.
I also understand that these violators cannot be forced to wear these bands.
Well, I think that depends on interpretation of law. Yeah, I look it up. The Infectious Disease and Control Prevention Act is, I look at the provision and say, well, it's kind of there's a quarantine measure, and depends how you actually see it. So I guess in the way that if you, it's not really the point where they say there's no express language requiring the people wear it, but there's some kind of similar provision saying that the government can impose certain measures to to deal with this situation, the infectious disease controlling.
I see. Anton, neighboring Hong Kong already have these wristbands in practice.
Right.
All arrivals to the country are required to wear them and also to download smartphone applications. What are your thoughts on this?
Well, in the particular case of Hong Kong, I think it's a little bit too much, definitely, because as you just said, it's mandatory for everybody arriving. And Korea has a very different case because it's now using this just for offenders. So it's kind of almost seen as a punishment, where in Hong Kong just everybody gets the bracelet right away. In Germany, of course, it would be very difficult to think about these issues. But then in the past days and weeks, we have seen a lot of measures all over the world which would have been kind of unthinkable just a few months ago. So I think there also lies the biggest danger with this whole thing, because if you have this technology and you start using this technology, then there's always the danger of infringement on human rights and privacy things that could be used in other emergencies. So basically, if you have opened this Pandora's box one time, then it's much more easy to open it in another case where we have maybe not an outbreak, but a political unrest of some case. And then people said, well, we used it back then. It kind of worked, so maybe we use it again. And I think that's the biggest danger. So you always have to wait, kind of like what is the positive effect of it? Is it really effective if people actually don't have to wear it? So is it something that we should rather refrain from, maybe?
Do we have these similar cases of self-quarantine violations in other parts of the world?
Well, I guess people all over the world are basically the same. So you always have a few bad apples somewhere that, despite the fact of being sick or despite the fact that they have a high risk of being sick, wander around and cause possible risk for other people. But overall, in the case of Germany, the weather finally turned out to be nice. I think the last weekend or so in Germany, and we have spring a little bit later than in Korea, and so there was a big question if people would kind of really go out, and but actually overall they didn't. So I think it depends a little bit also on the country, on the mentality. The Korean people are overall, I think, very well, doing very well. The Germans also. Maybe some other cultures. I saw, for example, in the US, people actually making demonstrations against self-quarantine or against being told to stay at home. And so it depends a little bit on your feeling, on your personal feeling, and on the national mentality, I guess.
Professor Ahn, there have been several cases here in the country where people initially tested negative at the airport and then tested positive, which is why government officials are saying the 2-week self-quarantine period is very, very important. I mean, there was a man in his 60s who was detained. He was charged for violating self-quarantine protocols. Surely this is a reckless and serious offense.
Yeah, I mean, you have to check how the system implemented right now, because I think that according to the press, the government make a call twice a day, the regular time, and also a random call, so 3 times a day. But they're not gonna call like 2 a.m. right, at 1 a.m. because you're not gonna, intervene in sleeping, right? It's kind of a invasion of privacy also, right? So they know that some people know that the government do not call you like in the morning early or too late, right? So I guess that the person in the news, maybe they went to sauna and maybe 11,
yes, I know. I heard
11
he went
p.m.,
yes,
because
he went
that's
to a
time
restaurant
very quiet.
as well.
And I met some people saying, oh, it's good to go sauna, it's so empty, right? Nobody there, right? So you can go like, so the logic's there, right? So I think it's kind of an education. It's kind of, I think the government have to keep educating the public about how serious, and then, but enforcing the stronger measure is not the only way. I mean, there's a different way too. So I think using it as a preventive measure, sending that if you not keep violating, you might end up wearing the wristband, right? That's kind of I think government should use it as the last resort and as the preventive measure, and then sending the educating public to the last resort here. So if you keep violating, that's the one you will get it.
I see. By educating the public, we're talking about raising awareness about the seriousness of the issue, the offences. Anton, as of April 13th, Korea has invalidated short-term visas for foreigners from some 90 countries. Now, this includes Germany. What are your thoughts on this?
Basically, I think that is not necessary, because you can control people when they come in and check people, and I think that's a much better thing to do, because once you close the borders, it's always the question, when will they open up again? And so what we need in this kind of thing, of course, we have to have some preventive measures in place, and that is perfectly okay. But I think we need international cooperation, and for international cooperation, people also need to move. They should move safely, and you should check people, and people maybe from particular high-risk areas should be basically kept from coming here. For example, if there's a city like Daegu or something in another part of Europe or so, where lots and lots of cases are there, then I have certain understanding. But to flat out cancel the visa, I'm not sure if this is helpful, because we also have to look at the economy, and people need to move back and forth to some extent to get the economy back on its feet, and for that people being able to free to travel in a safe manner is very important. So I don't think it's very helpful, and I can only hope that they will remove these measures and put things to where they were as soon as possible.
Professor Ann, what are your thoughts on these measures, these restrictive entry measures that we have in place? I mean, there are people, some in the public, who support such measures because they're worried about imported cases.
Actually, from my personal view, is that maybe timing issue. Maybe if they want to do it, maybe they should have done earlier. But now it's like, there's very small number of the foreigners getting into Korea right now because that other country already stop sending people and then stop getting. So I'm not sure about how effective the measure, because we miss the timing when you try to prevent people coming in. I think that's effectiveness question. Also, the government seems to be choose that open society, approach, right, rather than closing, right? So in order for them to keep their open society idea, I mean, they should need a stronger self-quarantine measure. That's kind of keeping balance. I think that's the dilemma here, because if the government want to try to close the society approach, maybe they could relax, the self-quarantine, because they will decrease number of coming from outside, right? So I think that's the dilemma of the Korean government. And so if you want to keep open society momentum, right, that's the things we'll do more stronger measure inside Korea. I think that's necessary.
Anton, going back to the idea of economic disruptions in light of the COVID-19 pandemic, could you give us a bit more information about that? Because that is a concern here in the country as well.
That is a big concern everywhere, I think, and it will hit some countries more than others. For example, China's economy has contracted in the first quarter 6.8%. That's the first time in more than around 30 years, I think, that it ever contracted at all. And in America, we've seen over the last weeks, I think, 22 million people losing their jobs. So the long impact of this is very, very big. And I think, obviously, Corona is a danger, and we have to face it somehow, but we also have to see how much of countermeasure is really helpful in the long term. For example, just to give you a basic example, last year or in 2018, 3,700 people died by car accident in Korea, but cars are still legal. And more than 17,000 people died from lung cancer, but cigarettes are still legal. So basically, society overall always have to weigh what is the danger and what is the benefit. So obviously, especially in the case of cars, you can't say, oh, people die from car accident. Okay, from tomorrow on, cars are forbidden. It just doesn't make sense. And I think with the economy and Corona, it's a little bit similar. So if you just say, okay, we have to wait until it's all over, okay, maybe less people will die, but then the economy dies, and that will have repercussions and a ripple effect. And maybe people could be suicidal. People who have built up their companies and their shops over decades could lose everything in a couple of months. And that's also a very serious concern, and I think that has to be addressed.
Which is why the government here is focusing a lot on the economy as well. Is the government in Germany coming up with similar measures to protect its economy, or the economy of Europe?
I think that is the reason why Germany has announced, despite the fact that compared to Korea, we are in a much worse place. We have overall more than 130,000 infected people, and a few thousand come new every day. So if you compare it to Korea, we are in a much worse situation. However, the German government has announced that we slowly move back towards normal, to a normal life, which means schools shall be open towards the end of the month, and so on and so on, and shops, certain shops at least, can be open. So the German government also realizes that if the economy dies, then okay, a few people die from Corona, but as I just mentioned, the repercussions, the economical fallout could be much worse, and it could be much more long-term, much more of a long-term problem than the Corona problem in itself. So it could be that Corona is mostly over in a couple of months if we have a vaccine and if we can contain it. But we could be in a depression almost for a year or two. And that is, of course, a much darker picture. And I think that's why economies around the world, Germany, Korea, US, wherever you look, basically are trying now to find a balance, like how can we keep the disease in check and at the same time not completely smother the economy.
Professor, and despite efforts by the government to impose tough measures to curb the spread of the virus, health professionals have been calling for tougher measures.
Yes.
Who do you side with, health officials or government officials?
Actually, in the beginning, I sided with the health specialist. I mean, because that I personally thought we should take more proactive measures, so to like, maybe shut down the, border, to prevent at the beginning. But now, I mean, timing is changed. Depends on you have to approach it. But now we talk about is it a timing issue? Is it really effective, doing any measure, controlling too much on the border? Maybe it's timing missed. I think we missed timing already, though. So now we have community. We're concerned about community spread. I think there's more concern. And then since the government going for open society, so I think that there was some you need to get kind of paradigm shift on how you do your business too, right? Because that now Korea is you can go any place, but nobody there, right? The restaurants empty, and it's very concerning because the economy really get very bad. Already I see that really downturn already, and then because there's no customers in the market and in restaurant. So I think that maybe we just come up with some ideas, say, how can you balance it, basically. And the economy, if people become diet, it's really bad. It will take a long time, really much longer to, you get the better economy. So I think that's a concerning part. That's what I'm saying.
Anton, do you see the similar kind of conflict between, let's say, health officials and government officials in Europe or in Germany?
Of course, you will always have that because doctors and health officials always see their main priority to keep the disease in check and to prevent people from dying. This is their job. But people who run the economy, their job is to keep the economy alive. And so both are very important things. And so I think Korea has done an incredible job and has also has gotten a lot of praise from all over the world for staying relatively open and still being very successful in containing the disease. And in Europe, for example, Sweden has also moved in this direction. Sweden has not made a shutdown. The schools are open, restaurants are open. And people predicted that it would be a disaster and people would be like die in the thousands or so. But it just didn't happen. And also Sweden has a slightly higher mortality rate from those people who are infected. But overall, Sweden is doing well. And they have no measures in place now, okay, we made a wrong choice here, we will change it. They keep going in that direction and the new infections are actually going down. And despite the fact of the schools being open, restaurants and shops being open. So it is possible to contain the disease and keep the economy running. And I think you have to find this middle path. And of course, people participating is very, very important because we all have the responsibility. We cannot just look to the politicians and say, fix this problem, They can only fix this problem if people on the street help in every possible way. Keep the distance and this and that, but also keep the economy running. And you have to give people the opportunity to get their life restarted and their business back on track. Otherwise, you will have thousands of people or hundreds of thousands of people in Korea alone who lose their livelihood. And like I said before, this is as much a serious problem as the disease itself, potentially, I think.
Yes, it is. Professor An, personally, how would you assess the government's overall measures to contain the virus here in Korea?
Well, I think that at the beginning wasn't really, I wasn't happy about how they implemented, but nowadays I think they're doing pretty good. I mean, trying to control and containing. But plus, there's some side from other, European, cases because Korea is a peninsula, right? There's nobody coming from the south, right? So and the north is closed by North Koreans, right? So it's kind of isolated, right? So if you control it, the traffic from outside, could have been much more effective in the beginning because there's no way they can get in. I mean, very difficult to get in. Different from the European countries, you can travel by car, bus, right? Train, right? So maybe that's really, just regret about something maybe could have been much better at the time beginning. But now, I think very concerning is that how can you contain it? I mean, the community spread. That's very concerned because it's very difficult.
The cluster infections.
And then plus and school someday will open up, right? So that the kid, coughing each other, here's my handcuff, shaking hands, touching each other. So that's very concerning. That's a question we have to answer. So, right.
Hopefully, they'll come up with measures to help with that. All right, Professor An, thank you very much for your thoughts, and Anton, thank you very much for being here with us today.
My pleasure.
Jusque dans vos bras. Wash your hands, lots of soap, 30 seconds in running water.
When you come, cover your mouth
And your nose with your sleeve. Do not touch, rub your face with your hands. Please be careful.
Don't forget, it's for you and for us. Wear a mask.
Keep your space from each other. Don't go out and stay home.
We will all come out strong.
So take care until we meet. I can do it. You can do it. We can do it. Yes, we can.
We will all come out strong. So take care until we meet. I can do it. You can do it. We can do it.
Yes, we can. Do your part
And stay safe. COVID-19.
Let's beat it.
Yeah!
Right, that was a fresh rendition of the Baby Shark song on COVID-19, sung by Korean idols and released by Arirang TV. And on that note, we say goodbye, have a safe weekend, and do join us again at this hour on Monday for a look at the efforts to ensure a cure for COVID-19. In the meantime, we welcome your thoughts and inquiries on our social media accounts or homepage, arirang.com.